Conversations with Dental Friends, the podcast for dental professionals who want to elevate their careers, grow with purpose, and actually enjoy the journey along the way. I'm Rachel, and before we dive in, if you've got a second, I'd love it if you could hit follow on the podcast. I know it's easy to forget, but it really helps more dental professionals find these conversations, and it means new episodes will land straight to your phone each week. No effort needed. This week I'm chatting with Mr. CPD himself, Aaron Stewart. Aaron is a standout dental nurse who's leaned all the way into education, development and making the absolute most of the profession. Aaron has been in the dental nursing world for 4 years and officially qualified in 2023. He currently splits his time between Ormo Dental Care and Paste Dental in Belfast, and let's just say he's not one to sit still when it comes to career growth. But I'll let Aaron tell you that story in his own words. Whether you're already a dental nurse, thinking about becoming one, or simply wondering how to expand the role in practice, this one is packed with insight. And if you're considering the move into dental hygiene or dental therapy, we've got you covered there too. Let's get into it. Hello, Aaron.
Hiya.
Welcome to Conversations with Dental Friends. Thank you so much for taking part in this today. Aaron and I had the pleasure of working together. We stay in close touch, and Aaron has been my absolute sounding board throughout this entire process. So I'm so glad and grateful to have Aaron here today on this podcast. So Aaron, let's start at the beginning. Tell me about your journey into dentistry. What steps did you take to get started, and what led you to dental nursing?
So me starting dental nursing, it was completely random and out of the blue. It wasn't something that was planned for me. I started my dental nursing journey in 2021. It was around summer that year. I was working in a call centre. COVID had sort of started to be faded out a little bit, and I was definitely getting tired of the call centre type vibes that I was getting from it. Before that, I was in my A-levels, took a gap year, did not know what I wanted to do. Always knew that healthcare was the direction I was looking to go down. Basically, I had went on to the Belfast Met website and I was like, healthcare or something that I was going to be able to work with people. The two options in the Belfast Met was veterinary nursing and dental nursing.
And I can see you as a veterinary nurse as well.
Do you want to know what? If I didn't have to see hurt animals, maybe that would have been the path. And so empathetic to be animals, I couldn't have done that. Yeah, seeing the dental nursing, and I always have been interested in teeth. I love seeing nice smiles on people. So I was like, do you want to know what? I'll give that a wee go. I'll see how it goes.
Brilliant. And I'm so glad that you did. So Aaron, when did you qualify as a dental nurse?
So I qualified in mid-2023. I would say it would have been around August, and then became GDC registered around October time. There was a bit of a delay on my end filling out the forms wrong.
I know there's always so much admin whenever you want to become GDC registered at the end. A longer process for some people than others, absolutely, depending on where and when you qualify. So Aaron, you've been qualified for quite a short time, but you've already achieved so much, and I always think about you as Mr. CPD affectionately. Can you talk us through the courses you've completed since qualifying and what you're currently working on at the moment?
Yes, absolutely. The first course that I did post-registration qualification as dental nurse was my oral health education.
Great.
Through the NEBDN. I don't know anyone that did it in Belfast. I didn't have anyone around me. I just knew that it did have that passion for actually talking to patients about their oral health, and I thought that would have been a good one to start off with. And so I'd completed that one, and then I went into looking into the radiography. I like doing a lot of
one.
Yeah, it definitely is. Hopefully done it now. That things are done for it, just awaiting the results.
Well done you.
That one was more of a journey than the oral health, and the oral health one definitely came a bit more second nature. The radiography one, I really had to sort of
knuckle down.
Yeah, it definitely wasn't my favourite one, but I've got that, and I'm grateful I did go on that. It has expanded my mind just in radiography and being able to look at an X-ray and see what you're looking at and not just trying to figure out what's on the screen. It's really good. So that one was definitely tougher and definitely was less passionate about that one.
I imagine a lot of people have less passion for radiography than other areas of dental nursing, absolutely.
No, absolutely. On top of that, I've done a few shorter courses. So I'm currently in the middle of just doing my fluoride application through the NEBDN as well.
Super. That's a super one because it's so practical.
It's very underutilized. I don't think a lot of dental nurses go for that one because it's just seen as something a dentist or a dental hygienist or therapist can just whip and fire onto someone's tooth in 2 seconds. But it has so many good applications, especially if you're doing stuff in the community or going out to younger populations. You don't need to pull somebody into a surgery for that under a dentist prescription.
And that background knowledge, I suppose, as well, just to have around that area is so beneficial.
I've done the alginate impression taken for dentate patients. I've done my intraoral scanning.
I love intraoral scanning. I love that.
It's definitely the future. We're using it for so much stuff, and both of the practices that I work in, we're using it a lot more for crowns and bridge work and stuff like that. And there's very few things that we're using the alginate impressions for, so it was definitely a good one for me to go on.
So nice for the patient as well.
Absolutely.
Much happier patient with a digital scan than a good old analog impression.
No, especially the ones with the gags. They're able to get work done now that we have an intraoral scanner that they never would have been able to get done previously
for the patient.
So it's really good, even being able to make people partial dentures where they couldn't have tolerated the impression long enough to get it.
Tell me a little bit about how you have, first of all, found these courses, Aaron, and how taking these courses blends in with your time in surgery.
So in terms of finding the courses, I always knew about postgraduate dental nursing diplomas from when I started doing the actual NEBDN core dental nursing training.
Yes.
As time developed and I figured out that I wanted to maybe go down a different route than dental nursing in the future, such as like dental hygiene or therapy, I was looking at prerequisites on university websites and it was something that was mentioned, so I did look into it a lot then. So I love learning face-to-face with a tutor directly, so that was something that was really important to me when I was choosing where to go through. There is lots of different places that offer these and that I looked into, but I went through a company called Smile Wisdom.
Okay.
And they're really good, especially the oral health education. The girl that runs it is amazing. She's a dental therapist and so passionate about it, and it definitely helped you take a lot in, even for people that were struggling. She had all the time in the day to answer questions, and I'm sure she was quite busy in her own clinical time, so the fact that she was able to do that was really good, and it was definitely worth the time and money that I spent on it.
I think post-course support is such a huge reason to pick a particular course, because you always think of a little something extra to ask whenever the practical session has finished. Aaron, you're obviously really passionate about these courses that you've taken. Is further education something that's really important to you?
Yeah, so to me personally, I can't sit still when it comes to doing extra courses. There's some of the ones that even other dental nurses lovingly in my life have turned around and said to me, oh, you don't need to be doing that. You're spending like a lot of money on stuff like that. Yes. I found myself that if I get complacent, I get really bored, and I love dental nursing and I love working in dentistry, but as a dental nurse, like other dental nurses can probably agree if they're listening to this, it can be something that if you let it can become really stagnant.
Sure.
And it can get very repetitive because it is the nature of dentistry. Unless you're working in a really obscure sect of it where you're seeing craziness every day, different stuff, you're going to be doing the same crown preps, fillings, hygiene visits, and what a dental nurse can do without postgraduate diplomas is limited during that appointment time.
Yes.
So I always thought that tie me over while I'm sort of working on other stuff in the background, non-dental related, I can further my scope, so I can help out with stuff. So that exam could turn into me taking the bite wings for the dentist.
Yes.
Or that sensitive tooth appointment where a patient's coming in because they have sensitivity in one of their back teeth. I can take the fluoride and put it on once the dentist prescribes it. I think stuff like that is what keeps me going to keep it interesting for myself.
Absolutely. I think I really relate to that because so much of what I do is for exactly the same reason.
Yeah. To
push myself to have a new challenge so that my day-to-day isn't so monotonous.
Yes.
Because so much of dentistry is very repetitive. If you were a newly qualified dental nurse today who was looking to upskill, or even a dental nurse who's been qualified for a long time that feels that they have a little bit more to give, what's a great course to start with in your opinion?
I think it really, really just depends on what your passion is in dentistry or dental nursing. For me personally, my major one, I love chatting to patients with periodontal conditions. So for me, it was a no-brainer. My first one was going to be the oral health education one.
Yes.
That's the one that I was drawn to. But it just depends where you're working, what you're going to get support with from work. I think that is a major thing. With these NEBDN courses, a lot of them do require you have a mentor. So pick one that you're interested in, but also one that your work potentially would be interested in.
And you'll have the support.
And you'll have the support. A lot of workplaces, I know the main one that they would be interested in would be the radiography, because it is something that they can apply.
So practical.
Yeah. Especially if you're working in orthodontics, taking the likes of an OPG and stuff, you're required to have that as a part of your scope and your indemnity. So I think just go with what you feel you want to do. If there's something that you think, oh, I would love to be able to chat to that patient confidently about their oral health, go for the oral health education.
Yeah.
And oh, I'd love to take that x-ray, go for the x-ray course. There is obviously much more, or you could just do what I did and collect
do them all.
And
collect them like Pokemon.
Yes, exactly.
Very good, very good. I think that's some really great advice. A lot of extra training in CPD is self-funded, which is a big commitment.
You're not always getting to apply it, and I think it's important to realise that it is something that is going to be very give or take of when you're getting to use it. But when you do get to use it, it is really satisfying for me personally. Being able to take the reins if the dentist is busy, taking the patient to another room, chatting about the oral health, their dental cleaning and stuff like that is quite good for me. That's what has made it worth it, is just being able to do that.
Brilliant, brilliant. And Aaron, like any job, dental nursing has its highs and its lows. Absolutely. We've experienced a lot of them together. But what's your favourite thing about it? What makes you wake up in the morning and feel proud of that work that you do?
Mine's is very cliche. I think everybody says the patients, but it genuinely is. I knew that I didn't know what I wanted to do when I was growing up, but I knew that I wanted to do something healthcare. I love helping people and I love sciencey stuff, and having that type of healthcare aspect of a job. So interacting with patients, especially in my main practice that I work at the moment, Ormo Dental Care, I've been there from starting. So all the patients know me,
yes,
especially all my regular ones with the dentists that I work with. So it's getting to help people, but also chatting to a lot of them like you know them, because you're seeing them for the lucky ones every 6 months for the past 4 years.
You see them more than some people see their family.
Exactly. And that honestly is, without being a complete cliche, the patients are my favourite because
I love that though. I think that's so lovely.
That is my favourite, because there is a lot of stressful parts of dentistry and dental nursing, but that does make it worth it. When you see a patient that you really like and their name's in the book, you're like, horrible morning, but she's in the dinner, so it's fine.
This day's going to take a turn for the better.
Yeah.
Brilliant, brilliant. And Aaron, if you met somebody just like yourself, somebody who's been researching dental nursing as you did and stumbled upon it on the Belfast Met website or wherever you're going to find it, and thinks it could be a good fit for them, what advice would you give them?
I would just say to go for it. Honestly, my experience with it is I was working in a call centre, found this course, right? I was starting on the 9th of September. I handed him into my current job and I was like, I'm leaving on the 9th of September, so that's it. And that's not practical for everybody. I was in a good situation where I was able to completely drop a job because I knew I didn't like it and go into something that hopefully I would like.
Which is a brave thing to do as well, I think.
And I knew that I needed that career change. I was willing to take that sort of risk, dropping money substantially to go on to do a training course without even the placement. So I was going forward with no job. That is not a practical thing for 90% of the population. It was just me being impulsive and knowing that I wanted to do something different.
Yes.
But I would say dental nurses, it's such a short-staffed career. So I think a lot of practices reaching out to them and asking, could you even come in and experience it for a week or shadow a dental nurse that's currently in practice with the potential to maybe come on as a trainee dental nurse. A lot of dentists and dental practices would jump at that opportunity.
I remember in another practice that I worked in, the practice manager had a really good idea of holding open days where she essentially had a group of, I think the one that I was involved in, there was like 20 people, 15 or 20 people came, and essentially the practice manager stood up at the front and explained what a dental nurse was, what the pay was going to be like, what the job was going to involve, what the hours were going to be like, and really let people have that insight. Because whenever you think about careers, and we have career discussions at school or at tech or anything like that, I don't think there's much spotlight shone on dental nursing as a career, which I think is a big miss because it's such a good job for so many people. What kind of person do you think makes a good dental nurse?
I think you have to be invested in it for the right reasons, and it's not the most well played or glamorous job. You're not going to be coming in with your big long acrylic nails and your hair done really nice. You're going to be leaving looking like you've crawled out of a hole by the end of the day in most of the cases, and so it takes that passion to actually want to be involved in the patient focused role to be a good dental nurse. I think the really niche ones, you have to sort of be able to work under pressure. I know a lot of trainee dental nurses that have came and gone from practices, even ones that I've worked in now and previously worked in, where they've only lasted a couple of weeks because of stress levels, which is absolutely fair enough. Nobody should have to deal with stress, but if you know you don't deal with it well, I don't know if it would be an amazing career choice.
You need to be quite resilient, don't you, and a bit gritty, because there will be it's a high pressure environment in a small space typically, and you've got to be fast. And you have to have sometimes quite a thick skin from a patient perspective, from a staff perspective. Not all the time, but that happens in any job.
Any job where you're going to be cramped in a small space with one or two other people constantly and higher stress situations are popping up, there's always going to be wee mini blowouts and stuff like that, and you just have to learn to take it in stride and not let it affect you. But that is quite hard for some people, and to expect that off everybody isn't realistic. There is people with different tolerances. I let everything glide off me. I'll just type away on the computer and then we'll wait and see what you have to say after. I think that's really important. I think you need to be a really resilient person. You need to be able to deal with stress well, but you also need to have that level of empathy when dealing with patients as well. And I think there is a degree of letting stuff slide off, but you also need to be able to work with people, because nobody likes going to the dentist. Very few people say, oh, I can't wait to get in and have my checkup and my clean.
Although we probably would.
Yeah, no, well, I'm the opposite, but we're not normal people. You have to be able to work with people in that way, even if you don't understand it. I go into the dentist, I'm absolutely loving the fact that I'm going to get a clean in 20 minutes, but there's someone where they've been thinking about this up all night the night before and isn't the thing that they want to be doing today. So you always have to be a very intuitive person and work with people.
Emotionally intelligent. Yes, I think that's really good, because nobody's going to fit a perfect profile, but they're transferable skills across a lot of different jobs that I know a lot of people have that maybe wouldn't necessarily initially think about dental nursing. Dental nursing, like everything now, is always evolving as dentistry moves forward. How do you see the role of dental nursing adapting in the future, Aaron? Do you see any big changes on the horizon?
I definitely see the need for an expanded scope.
Yes.
It is quite difficult to just say they should be able to do this, because a lot of people go into dental nursing for the sole reason it is a shorter term diploma compared to other aspects of dentistry or healthcare, like your regular nursing or your dental hygiene or your therapy, and a lot of people are attracted to it because of its lack of prerequisites to get into, and it's an easy career to get into because
to get your foot in the door with.
I think that an increase in scope is definitely needed to take some of the burden of dentists and hygienists and therapists and every aspect of the dental team. I think obviously the postgraduate diplomas, they have been a thing for a good long while now, and they do help with it to a degree, but I think that there is in the future going to have to be a little bit more that dental nurses are able to do, even if that means taking on extended courses and working that way for us. But I definitely do think for dentistry, especially in the condition it's in at the moment, and continue on and thrive, especially with the amount of the populations constantly going up and the need for dentists and dental hygienists and therapists is going up, but those levels of people qualifying in that field is sort of staying the same. That dental nurses, because it is a shorter term degree and it's easier to get into, would be definitely something good to look into improving their scope and this help lessen the burden of the need to have loads of dentists and dental hygienists and therapists, because it is a more intense degree to get into and finish.
And I think that naturally will happen across all areas of dentistry because of demand.
Yes.
We've been very lucky with the passing of the exemptions bill, where dental hygienists and dental therapists can now work with certain prescription-only medications and deliver them after some additional training, which is amazing, huge for our profession. And I hope that that continues to grow for my profession, but also naturally then that should happen across general dentistry and expand out that scope a little there, because there's so much demand around other niche areas and then also in dental nursing as well.
Yeah, absolutely.
So Aaron, what is next for you? What's the next big goal you're working towards?
So for me, the next goal is the first and foremost, make sure that all of these postgraduates are done and dusted, completely passed, and
your
not
collection
looming.
is complete.
Yeah, which I think is very soon. I think I've done most of the ones that would interest me. I'm not just doing them to do them. It is something that I want to do to help fulfill that passion that I have for them.
Yes.
And I think to do the rest of them would just be a waste, because it's not my passion to do those ones really at this point in my career. In terms of this mid-term goal, and the next step for me would hopefully be progressing on at some point to university to do a degree in dental hygiene or dental therapy.
Love this. I love this.
It's something that obviously I've been soft launching and slowly working towards with doing the postgraduate diplomas. And I'll be looking into other aspects of meeting further prerequisites for that in September time, maybe looking into an access course, steering my education more away from the dentistry side of it and meeting more of the general prerequisites to increase my chances. But at the moment, it is just mainly focusing on the dental nurse aspect and getting all those postgraduate diplomas done and dusted and wrapped up, so I can start working on other aspects.
And you've started the application process as well.
Yes.
For dental hygiene and dental therapy. Can you tell us a little bit about what that application process looks like?
It's very stressful, first and foremost. It's a lot of applying, waiting, getting an interview or getting knocked back for interviews, which is obviously, it is quite disheartening, but nothing that you're meant to do will pass you. You will eventually get it. And I think that's sort of the attitude that you have to remember. And if it's something that you really want to do, you will keep going for it. I don't know a lot of people that's got on their first time. Like
I certainly didn't.
Yeah. I have a friend that she's recently gotten, and she'll be on maybe in the future. But she's been a dental nurse for 6 years and applied 3 times and only get in this time. So she's been actively applying for 3 years and wanting to do it probably for a good 5 out of those 6 years. And it's really good to see stuff like that, but it helps you remember that it is something that will come eventually if you're really interested in it and you put in the hard work to meet those requirements, because it is such a competitive, field. For a lot of people, a lot of dental nurses, they see it as their natural next progression. It's not even a question. So you're competing with so many dental nurses that are really passionate about it. And it's important to remember that you're not the only one with passion. And other people deserve their shot as well. And if they've done what they need to do, they deserve it as much as you. So it's that major aspect. But the applying, then the hearing back, and then you get your interview, and then you have to do a lot of waiting depending on when you did your interview. I applied quite late this year. I applied a few days before the deadline.
I think you were poked
Yeah.
by a lot of people, including me.
Yeah. Rachel was very kind to write my reference for me this year, so it was really kind of her to do that. But I was very much in the mental space of I had just left another job that I had went to, and I was coming back to Ormo Dental Care, working in Pace Dental as well as a part-time dental nurse there, working with their implantologist and sometimes with their hygienist. But then chatting to both of the teams, and they agreed that I should absolutely go for it.
They want the best for you as well. I think as a community of people in dentistry, we all want to see each other do well, and we want people to achieve their full potential. So did you apply through UCAS then?
Yes, so I applied for UCAS, which is always an absolute nightmare.
And
I applied last year as well. I didn't have really any of the prerequisites that I had now. I was only really applying off of the guise of being a dental nurse and some like old...
Which sometimes is enough.
Is enough. That does give, I think, a lot of people hope. If you want to be a dental hygienist and you have that passion, but you can't go back and do an access course, or you can't go back and do your A-levels, sometimes that is enough, but it is so competitive it is hard just to get in off that.
So what aspects did you have to fill in on your application? Obviously your details, and then you did a personal statement.
And I had to then add in qualifications that I got when I was 14, 15 for my GCSEs, and had to scarper through all the old certificates that I never thought I was going to look at again.
Yeah.
And then older A-level ones that I'd done. And then I went back in my second year of A-levels and decided that I wanted to do at least a science-based one, because I knew that healthcare was something that was looking to go down.
Right.
So I ended up doing art as an A-level. I ended up doing music as an A-level. I did health and social care, to be fair, which was probably a smart choice, but then I went and did like a general science A-level, so it wasn't a specific one, but it incorporated all three. I had to put all those
onto your form, and then the nervous wait. But you did get a couple of interviews. Can you tell us a little bit about the interview process?
Yeah, absolutely. So for me personally, I had 2 interviews out of the 5 choices that I'd applied for, and I then had 2 of the interviews initially. Actually ended up getting a 3rd interview as well, just due to a mix up with the application. But the 2 main ones that I had, I have done them quite recently in terms of wait time, because a lot of people wait months for them. One of the interviews was more traditional, what you would expect from an interview process. It was a lot of questions about resilience and patient care and why I would be a good dental hygienist and why I was interested, just the ones that you would sort of imagine. The other one, the way the interview was set up, it was definitely not traditional. I actually had to submit a presentation, and then I had to go to a shorter interview. It wasn't as traditional. It was just more asking about me as a person, more getting to know you, why you wanted to do it. And then I also had to do group work with other applicants,
Amazing.
Which I thought was quite good. Both of the interviews were completely different, but I liked both of the vibes. I was sort of ready for both scenarios.
I'm sure you've learned so much about the process by doing those interviews. Only good things can ever come from throwing your hat in the ring and giving everything a try. And Aaron, I just wish you the best of luck with your outcomes, and I know that you will be an absolutely fantastic dental therapist or dental hygienist, whichever pathway you decide to go down. A brilliant addition to our profession, and thank you so much for taking the time to chat to me today on Conversations with Dental Friends.
Thank you, really appreciate it.
No problem.
Thanks.
That's it for today's episode. What a brilliant, brilliant conversation with Aaron. I just want to take a moment and say how proud I am of him. He's recently been accepted to study oral health sciences at the University of Inverness, which is such an exciting next step and a real testament to how much he has invested in growth and career. If you're feeling inspired and want to dive deeper, I've added links to the courses Aaron mentioned in the show notes. You can also find him on Instagram at Oral Health with Aaron. This is a pretty new page, but I've no doubt this is going to be such a valuable space for dental nurses and students. I've also linked the NEBDN dental nursing course in the show notes for all you budding, enthusiastic dental nurses to be out there. If you enjoyed this episode, I'd love it if you could give the podcast a follow on Spotify or wherever you listen. It really helps more dental professionals find us, and you'll get new episodes each week without even having to think about it. You can also catch up with us over on Instagram at Conversations with Dental Friends for more behind the scenes chat and episode updates. And if you want to follow along with me, I'm there too at Homegirl Hygienist. If you thought Aaron did a great job, please like, share, and pass this conversation on to your friend in dentistry. Thanks so much for listening, and I'll catch you next week on Conversations with Dental Friends.